Could you please start the role play conversation? Thank you.
Good morning.
Hello, yes.
My name is Vanati George. I'm one of the registered nurses working in this hospital. You seems to be anxious. What brings you today here?
Actually, my baby is not feeling well. She's having very bad cough and she's not sleeping last 2 days. I'm just worrying that she has something wrong. I would like to see the doctor. Can you please help me?
Sure. I'm really sorry to hear about that. Your baby is suffering from cough and some breathing difficulties. Before moving into further, how may I address you?
Please listen. I'm telling my baby is sick, so I want to see a doctor immediately. At least you do some observation with her. That could be a great help. Please do it soon.
Yes, ma'am, it's really understandable. But before moving into further, I have to assess the child. Could you please tell me in detail what's happening to your child?
Yes, I told you already that my daughter is not sleeping last 2 days and having a bad cough, and she's having like a chesty wheezing like sound. I'm worrying that she having a asthma or something like that. I don't know. I can't explain too much to you, but please assess her and do something. I have to see the doctor very urgent, please.
Yes, ma'am, I can sense your feeling, but today the emergency department is very busy. Doctor will arrive here shortly. But before that, if you don't mind, shall I assess your child?
Yes, sure.
Thank you for your cooperation, ma'am. So you told me that, as you told that your baby is suffering from like wheezing, whether your child has diagnosed with asthma?
Not really, but frequently the climate change, like a winter time, and she's having this kind of issue. Even last year also she had the same issue, and even this year also she's like continuously, like 2 weeks before she had the same problem, and again this is the third continuous week, so I'm worrying a lot.
Okay, based on your information that I can understand, your child is suffering from asthma. Maybe she is exposed to some cold area that leads to constriction of the bronchioles. That's why your child is suffering from breathing difficulty. So if I will assess her vital signs, I will make her complete assessment. It is helpful for the doctor to come and make the exact diagnosis. Is that okay with you, ma'am?
Okay, please do it fast. That could be good.
Okay. Privacy must be ensured. I will assess your child's vital signs. So based on my vital signs examination, your baby's saturation is okay. She is maintaining oxygen saturation in room air. But don't worry, doctor will arrive here shortly and he will come and examine the child.
Okay.
Is there anything else I need to clarify for you, ma'am?
No, that could be great. Thanks.
Thank you. Thank you for your cooperation.
All right. I would like to thank both of you guys for performing this role play card in an effective manner. Firstly, I would like to give you a few comments on Vanati's speaking skills before I give her the score. Okay. So first of all,
sir.
you have completed the role play conversation in 4 minutes itself.
Okay, sir.
You could have provided a summary in the end of the role play conversation.
Okay, sir.
So that could have been done. Okay, please utilize 5 minutes. Okay, you could have at least used another maybe 20-30 seconds, to summarize and then ask maybe a few other details and so on. Okay, you could have done that quickly. Okay, that's one thing.
Sir.
However, okay, there are many good things in your role play conversations, and I'm really amazed at the way that you have started your introduction. So your introduction was amazing. I'm very happy with that.
Okay, sir.
The way you introduced, the way you have addressed the patient's concerns, in the beginning and throughout the conversation was really good. So you were able to address the patient's concerns correctly and politely. I'm very happy with that. So you did a very good job. Okay.
Okay.
Only a few grammatical mistakes need to be rectified, but apart from that, your role play conversation was simply exceptional. Okay. All right. Let me
Okay,
give you
sir.
the
I will.
feedback on your grammar.
1
Okay.
second, sir. I will
You-
take the note.
Yeah, you were able to pronounce. You were able to pronounce all the words accurately. I'm very happy with the way that you pronounced them. Okay, it's really good. You have done a wonderful job. You were able to ask one question at a time, so that's good. So it's really good. I'm very happy with the way that you were doing this one. Okay, and the good thing is that your polite phrases were soothing, calm, and make the patient relaxed. Okay, so you are able to make the patient relaxed and calm, so it's really good. All right, you established an excellent rapport with the patient as well. Okay, with the patient by thanking her, appreciating her, and asking consent before you do anything. So you have done a perfect job. Being an ideal healthcare provider, this is what you have to do, and you have done exceptionally well in those areas. Okay, I'm very happy with the way that you do it. Okay, you have requested the patient appropriately as well. Okay, so it's all good. All right, vocabulary is good. You were able to pronounce them. You were able to use a range of sentence structures as well. Sentence structures such as simple, complex, and compound. It's really amazing. Without any mistakes, you have done that. So I'm very happy with that.
Okay, sir.
You were
Okay, sir.
able to address all the bullet points of the role play card. I hope so. I will just have a look at it in a minute. Okay, I'll just go through that. So you were able to explain that the emergency department has been busy. That's good. Ask the patient to briefly explain the conditions. That you have done that as well. Explain what the doctor will do. Yeah, that's also good. Reassure the parent that you're doing everything possible to take care of the child who is stable. A doctor will attend shortly. That's good as well. Encourage the patient to relax, parent to relax, and allow you to attend the child. Explain that you need to continue taking child's vital signs. Did you mention this one?
Which one, sir?
This one, the final bullet.
Yes, sir. I told. Yes, sir.
Okay.
I told. I have.
Okay.
Based on my examination, oxygen saturation is normal. Your baby is stable. Shortly, doctor will arrive here. I said no, sir. That
Yes,
I
okay.
mentioned oxygen saturation is stable. I said.
Yeah. Okay. You could have used a few more synonyms. All right. Few more formal
Okay,
synonyms.
sir.
All right. Instead of saying
Okay, sir.
shortly, you could have used it as soon as possible, at the earliest, and so on. For example.
Okay.
So try to
Okay, sir.
avoid repeating. Try to avoid repeating the same phrases from the case notes.
Okay, sir.
So use their synonyms. Sorry, from the role play card. Instead, use their synonyms as much as you can, please. All right, that's the next
Okay,
thing.
sir.
You could have used more connecting phrases. That is one area of improvement, but you were able to use connecting phrases to some extent. It's all right, but it could have been somewhat better. Okay.
Okay, sir. Okay, sir.
And then the next one is yeah, perfect. You were able to clarify patients' questions very well. I'm very happy with the way that you responded to the patient's questions. That's really good. All right, so these are the good things. Okay, you are able to make the patients relaxed. You're able to address the patient's concerns. You are able to establish good rapport. You are able to provide information in an appropriate manner. You were able to use vocabulary, but you could have improved the use of synonyms. Okay, that's one thing I would like to ask you to do. So use of connecting phrases,
Sure,
use of synonyms, and then there is another one. Grammar could have been much better.
Okay, sir.
Grammar could have been much better because you have committed some grammatical mistakes. I'll give you a list
Okay,
of them,
sir.
okay?
Okay, sir. I'll write
As
again.
below. All right, let's
Okay,
say. So the first one is, all right, the first one is what? Okay, one is, maybe, sorry. Okay, so first one you have said is about that your, I'm sorry to hear about that your baby. I'm sorry to hear about that your baby is he's suffering from, he's suffering from blah, blah, blah. Okay.
Okay, sir.
So you should say, I'm sorry to hear that your baby
Okay, sir.
is suffering from, or whatever the phrase you want to use. You should not use I'm sorry to hear about that your baby is suffering from. Otherwise, if you are really keen to use about, you can use so. I will give you this sentence structure for you. So you can say, I'm sorry to hear about your child's problems, okay, or breathing problems, whatever the problems, breathing and wheezing problems, for example. Okay, you can also use this. So after about, you have to use what? You have to use only the noun. Otherwise, it's better to use this one. It's better to use the first one. I'm sorry to hear that your baby is suffering from something, whatever you wanted to say.
I'm
That's
sorry
one
to
grammar
hear that.
mistake.
Okay, sir.
Yes. And
Okay, sir.
then the next one is before moving into further. Okay, so that's wrong. Before moving further.
Moving to further.
No, you don't
Before
need to say
moving to
moving into. That's again wrong. It's before moving further. Okay, that's it.
Okay.
Don't place
Okay.
any prepositions after sorry, after moving. Okay, otherwise you can use
Okay,
before
sir.
moving ahead. Okay, or you can say before discussing further, something like that. You can use that, but you
Okay,
don't need
sir.
to use any
Okay, sir.
prepositions over there. That's wrong. Okay.
Okay, sir.
And the next one is
Okay, sir.
based on the information. Okay, you said based on the information that I can understand. That's wrong. You should have said
Okay, sir.
before. Sorry, I used the capital letter by mistake. Yeah. So this is wrong. So what you should have done is you should have said this: based on the information I can understand that. You don't need to use that I can understand. Do you understand? You have to say based on the information
Based on the
I can
information,
understand
I
blah
can.
blah blah. Okay, that's what you have to do.
Okay, sir.
But apart
Okay,
from that, there were no many grammar mistakes. All right, everything else is good.
Okay.
I'm amazed at the way you have been talking. I'm amazed at the pace you have been talking. Okay, so the pace was good. The speed.
Okay, sir.
Was good. Okay, so it is correctly paced. Okay.
Okay.
All right. Let me give you the expected score. All right, let's say. So you have committed 3 grammatical mistakes, and then you could have summarized in the end. You have completed the role play conversations well in advance, which is not that good. Do you know what I mean? However,
Okay, sir.
you were able to address all the bullet points, and then you were able to, make the patient calm down. So it's good. Actually, you were able to persuade the patient. I'm very happy with the way that you have done. So I'm very happy to give you 350 out of 500 for this role play conversation. Okay, I'm very happy.
Really, you are giving 350, sir?
Of course, you will be able to get 350. Okay, I'm pretty confident. There's a great improvement in terms of grammar, in terms of speech rate, in terms of addressing the concerns of the patients, blah blah blah. So you have done so well. Okay, so only 3 areas you need to focus on. One is a bit of synonyms, and then connecting phrases,
Okay, sir.
and then grammar. But try to conclude the summary as well. Try to
Okay,
use
sir.
5 minutes fully. That's what you got to do. But apart from
Okay,
that, you
sir.
have done a great job. I'm very happy to give you 350 for this role play conversation.
Okay,
Are you
sir.
happy with my
Thank you, sir.
assessment?
Yes, sir. Sure.